Concerns about COVID-19 vaccine supply, prompting questions about the safety of the two-dose process. Massachusetts continues to open more vaccine sites, but state health officials say they're reliant on whatever the federal government sends them in terms of dosage numbers. Western Mass News reporter Audrey Russo getting answers tonight in Springfield on what you need to know while waiting for a second dose. Audrey?
Both the Moderna and Pfizer vaccines require a waiting period in between the first and second dose. But with state health officials uncertain of the number of vaccine doses they'll be able to get, even at mass vaccination sites like this one coming to Eastfield Mall, it's got some people wondering whether or not it's safe to get that second dose a little bit later than what the drug manufacturers recommend.
For the Pfizer vaccine, that was 21 days later, and for the Moderna vaccine, that was 28 days later.
For those who have yet to get their second dose of the COVID-19 vaccine, news of potential vaccine shortages likely isn't making the waiting process any easier. Robert Roos is the chief medical officer at Mercy Medical Center. He tells Western Mass News those waiting periods are recommended by the researchers.
Those time frames for the first and second dose is what we base the efficacy data on in our recommendations going forward.
In fact, he says the Centers for Disease Control has indicated it's safe to get the booster up to 4 days early, which could help people trying to schedule dose number 2.
They have not given a time frame after the intended time for the second dose as being acceptable, but they just encourage people to get it as close to the regularly scheduled second dose date would be as possible. But if it is delayed, they are not recommending that people need to repeat the vaccine series.
State officials are standing up mass vaccine sites across Massachusetts, including the one in Eastfield Mall in Springfield. They say these sites will have the capacity to vaccinate more people than the number of doses that will likely be made available from the federal government. State officials say the goal is to begin with the capacity to vaccinate 500 a day at these sites, which Roos says will take some of the burden off local healthcare facilities.
Mercy Medical Center, we have the capacity to do about 1,000 a week, which is not nearly enough for the entire community, and it's going to take all of us to contribute to this effort to meet that demand.
For those who are eligible, you can sign up to make an appointment at this mass vaccine site starting tomorrow. The link to the state's website will be on our website, westernmassnews.com. And remember that phase 2 starts next week, and the first category to be prioritized within phase 2 are adults 75 years of age and older. Live in Springfield, Audrey Russo for Western Mass News.